And today's study club topic is no hype, no pressure case presentation. And here is our head instructor, Larry Gazzardo.
Well, good evening, everybody. It's Larry, and Happy New Year. And I'm really happy once again to be here with all of you. I can't, there's so many important things to running a dental practice, and there's so many components to communicating with your staff and with patients, but I can't think of one that's probably more important and creates more gnashing of teeth than when we have to present treatment. I want to debunk a lot of the things that probably get in the way and make you feel that way. And I think it's because there's not a problem with the way that you actually present treatment. It's probably the issue is how you develop your treatment plan itself. Because I would agree, if I put myself in a position where I'm writing a treatment plan, but I don't really know if this is what the patient wants to take care of, or if it's what they think is important, or if I think that oh my gosh, maybe this is outside of their budget, my gosh, I'd be grinding my teeth too. Matter of fact, I'd be getting very, very anxious the whole time I was writing the treatment plan, because I'd be saying to myself, I have no idea whether the patient wants to do this or not. And that's what I want to help you with. I want to help you go into a treatment presentation time with your patient knowing that you're bringing the information that they're looking for, and that you're presenting them with a treatment plan that solves the problems that they want to have taken care of. And so that's the basis that I want to talk to you about today. Because what we're talking about is you and the patient promoting a free exchange of information. And you've got to have time to listen to the patient to be able to do that. And of course, I want you to be as relaxed as possible, because when you're relaxed, you're going to be natural. And I want you to be able to use your own personality style to your advantage. I don't think any of you have to change who you are, and you don't have to have any kind of a lobotomy to be able to talk to patients, but you do have to feel comfortable talking to them. And so that's why we call this no pressure, no hype, and I'll add to it, no manipulation. And the reason for that is because you're asking your patients to make a big decision. And I don't even have to tell you this, but you know that if you try to, add on the hype, if you put in a lot of manipulation, like you're trying to talk them into it, or you're trying to guilt them into it, then all that does is add pressure to the decision-making process. And we all know that when anybody's faced with making a big decision, the person is going to react negatively to any kind of pressure. So I don't want you to feel any pressure, and I certainly don't want the patient to feel any pressure. I want you to be genuine, sincere, and authentic. And so I want them to hear what you have to say so that they can decide on their own. So let me just give you like 7 pointers here to help you out. Number one, I think all of us have to realize that nobody else or nobody ever likes other people's ideas. They never do. Or at least when they hear other people's ideas, they always feel like they can't be right. So we just have to expect that we're always going to get pushback. And I think I say that to start with because we get nervous as soon as the patient starts to push back, like, but why do I have to do this? Or, when I have to do that right away? Or how much is that going to cost? We all start to get very, very nervous. And so we should be prepared for those things, because I guess I can say is it's only natural that people are going to resist whatever it is that you have to say, because that's what we see happening in nature. So number one here is that people tend to resist other people's ideas. And because of it, that brings me to point number two, that people won't trust you if they don't feel that you understand them. And so we have to realize that when we're examining patients, again, this is when I act like I'm a dentist, but I'm not, but we have to remember when we're examining patients, when we're doing that, that's just not a time for us to gather data. It's also a time for us to have an exchange with the patient. You know, as we see things going on in their mouth, that's where you have to stop and point it out. You know, I think you can see as I'm examining you, there's quite a bit breaking down in your mouth. I'm not sure that you were aware that any of this was going on. You know, Miss Jones, how do you feel about what's happening to you or what's been going on? Has anyone ever talked to you about the type of problem that you have? My point is that we can't expect just to, you know, gather a bunch of data and then, you know, write up a bunch of treatment and expect that patients are going to have a bunch of time and money to be able to solve those problems. Your examination is also a time for give and take. So my second point here again is that remember, people are not going to trust you if they don't feel you understand them. So that's where you want to talk to the patient. Matter of fact, I'll tell you today with the demographic that you're dealing with and the fact that they all think they know more than you do, I'll just tell you they're not going to trust any decision that you make. They're not going to respect any decision you make unless they've had the opportunity to provide input. So talking to them while you're gathering data is extremely important. The third part is that, you know, everybody seems to have a story, so you want to make sure that you get the story out. And patients just aren't going to just tell you this. You've got to create the opportunity for them to talk about it. And usually the story that they're going to tell you, like why they haven't been to the dentist, or why they've been afraid to get some treatment done, or why they haven't completed treatment in the past, what I want you to hear is that story that they're going to tell you is probably really relevant to where they want to go. And what we're trying to determine is how healthy do they want to be. Because I believe that it's our jobs in dentistry to help people be as healthy as they want to be. We just have to understand that they don't always want to be as healthy as we would like them to be. But we can certainly help them. So giving them the opportunity to talk is very important, and just listening to that story. So here, you don't want to ask direct questions like, does this bother you, or do you mind this, or is this something you would like to change, because you're just going to get yes or no answers. This is where you want to ask open-ended questions, you know, so that way the patient is forced to give you some conversation. You know, and so those are the types of questions where you would ask, tell me about this, or, you know, how do you feel about what's going on? You know, what happened here? You know, those types of questions. But while you're examining them, don't be afraid to stop your exam to let them speak, because while you're examining and you're gathering all this data, they're thinking something's going on, and we know people today have some opinion about it. And the sooner you learn that opinion, the easier it's going to be for you. The fourth point that I wanted to make was that people usually don't want something bad to happen to them. They usually don't want to have something bad, and so it's not just about, oh, you're going to look better and you're going to be healthier and things like that. Usually what you want to be able to do is say, look, we don't want you to have to spend more money. You know what I mean? Because they're trying to avoid some kind of negative thing happen to them. So reminding them about the implication of not accepting treatment is going to be important. And so you want to help them avoid, like I said, that negative consequence. People tend to be more motivated to avoiding something than thinking like, oh, you know, I'll be happier if I do this, you know, type of thing. So you want to let them know that we'd want to do this so that your teeth wouldn't get darker, or so that they wouldn't wear down anymore, so that this process won't develop into the bone. You know what I mean? Like you're giving them the implications of why you want them to move forward with treatment. The fifth point is that if they're given the opportunity to talk and they say something, they probably said it for a reason, and so we shouldn't just ignore it. What we have to learn to do is ask questions about the things that people say. So if they say it, they probably said it for a reason. And so my sixth point is that they're going to accept treatment for their reasons and not ours. And so when they talk, you want to be able to pay attention. because you want to ask them questions about what they said. You know, like, it's interesting that you brought that up. Tell me more about it. Tell me how that's important. What's your expectations, you know, for how healthy you like to be? And so you want to learn what those reasons are, because obviously those are the reasons that will impel them to move forward with treatment. Unfortunately, it's never for our reasons. And so the seventh point here are reasons. And so the seventh